Question 1. A 4-year-old child, Jamie, is brought to the pediatrician with a concern for developmental delay. The parents report that Jamie is not speaking in sentences and has not started potty training. Additionally, Jamie is often hyperactive, running around the house without seeming to pay attention to anything and has difficulty staying focused during activities. After a thorough developmental assessment, the pediatrician suspects ADHD, attention deficit hyperactivity disorder, as a possible diagnosis. Which of the following is the best initial step for diagnosing Jamie's condition? A. Initiate a trial of stimulant medications to assess for improvement. B. Refer Jamie for a comprehensive developmental evaluation, including a behavioral assessment. C. Wait for the child to reach 5 years old before considering a formal diagnosis. D. Start a daily routine of structured activities without further evaluation. Answer. B. Refer Jamie for a comprehensive developmental evaluation, including a behavioral assessment. Explanation. ADHD diagnosis in children under 5 years old can be challenging due to the overlap with normal developmental behaviors. The best practice is to conduct a thorough evaluation, including standardized behavioral assessments and observations in various settings, home, school, etc. ADHD screening tools and criteria from the DSM-5 Guide Diagnosis. Medications should only be considered after a comprehensive assessment confirm ADHD. Starting treatment without proper diagnosis may lead to unnecessary risks. Early intervention is crucial for improving outcomes, and diagnostic clarity is essential before initiating pharmacological treatment. Question 2. Which of the following vaccines is recommended as part of the standard pediatric immunization schedule for a 2-month-old infant? A. Rotavirus vaccine. B. Measles, mumps, and rubella vaccine. C. Hepatitis A vaccine. D. Human papillomavirus HPV vaccine. Answer. A. Rotavirus vaccine. Explanation. The rotavirus vaccine is a part of the recommended immunization schedule for infants, typically administered at 2 months, 4 months, and 6 months. The MSAN HEV vaccines are given at older ages, usually 1 year and 2 years, respectively, and the hepatitis A vaccine is given at age 1 and again at 18 months. The rotavirus vaccine helps prevent gastroenteritis caused by rotavirus, which is a common cause of hospitalization due to dehydration in young children. Adhering to the recommended immunization schedule is crucial for preventing serious diseases in the pediatric population. Question 3. Mr. Thomas, a concerned father, brings his 10-year-old son, Luke, to the pediatrician because Luke has been having frequent episodes of chest pain and difficulty breathing. The pediatrician performs a thorough physical exam and auscultation of the lungs, which reveals wheezing and prolonged expirations. The child has a history of asthma and has required albuterol inhaler treatment in the past. The pediatrician is considering adjusting the management plan. What would be the best next step in Luke's treatment plan? A. Increase the frequency of albuterol inhaler use to 3-4 times daily. B. Prescribe an inhaled corticosteroid to manage chronic asthma symptoms. C. Start a course of oral antibiotics to treat possible underlying infection. D. Advise Luke to avoid all physical activity to prevent worsening symptoms. Answer. B. Prescribe an inhaled corticosteroid to manage chronic asthma symptoms. Explanation. Given Luke's history of asthma and recent symptoms of chest pain, wheezing, and difficulty breathing, a step up in asthma management is appropriate. Inhaled corticosteroids are the first-line therapy for managing persistent asthma symptoms and controlling inflammation in the airways. ICE helps reduce the frequency and severity of asthma exacerbations. Increasing albuterol use would only provide temporary relief of acute symptoms and does not address the underlying inflammation of asthma. Antibiotics are not indicated unless there is clinical evidence of a respiratory infection. Advising complete avoidance of physical activity is not recommended as exercise can help improve lung function and overall health, though it should be managed carefully. Question 4. A 6-month-old infant, Ella, is brought to the pediatrician with a concern for poor growth. Her parents report that she was born at 34 weeks gestation and has had difficulty feeding since birth. Ella has been receiving breast milk with occasional formula supplementation, but her weight is below the 5th percentile for her age. Upon examination, Ella appears lethargic, has a weak cry, and shows signs of dehydration. What is the most likely cause of Ella's failure to thrive, and what is the best next step in her management? A. Inadequate breast milk supply. Recommend exclusive formula feeding. B. Premature infant-related feeding difficulties. Initiate evaluation for feeding therapy and metabolic disorders. C. Gastroesophageal reflux disease. GERD. Start antacid therapy and monitor weight. D. Cystic fibrosis. Begin sweat chloride test and refer for genetic counseling. Answer: B. Premature infant-related feeding difficulties. Initiate evaluation for feeding therapy and metabolic disorders. Explanation: preterm infants like Ella often experience feeding difficulties and failure to thrive due to immature oral motor skills, reduced energy reserves, and potential metabolic disorders. As a 34-week preterm infant, she may require specialized feeding techniques, more frequent feedings, or higher calorie formula. Premature infants are at high risk for conditions such as metabolic disorders, which should be evaluated when there are concerns about poor growth and lethargy. GERD could also contribute to feeding problems, but the overall context suggests that prematurity-related issues are the primary concern. Cystic fibrosis is a possibility, but less likely based on the current clinical presentation without respiratory or digestive symptoms. Question 5. A 15-year-old girl, Sarah, presents to the clinic with complaints of fatigue, weight gain, and constipation. Her physical examination shows a dry, pale skin appearance, delayed reflexes, and a goiter. Blood tests reveal an elevated TSH level with low T levels. What is the most likely diagnosis and what is the best initial treatment? A. Hypothyroidism. A prescribed methimazole to reduce thyroid hormone production. B. Hypothyroidism. Initiate levothyroxine therapy. C. Iron deficiency anemia. Recommend iron supplementation. D. Type 2 diabetes. Initiate metformin therapy. Answer: B. Hypothyroidism. Initiate levothyroxine therapy. Explanation: Sarah's symptoms, including fatigue, weight gain, constipation, and goiter, along with laboratory findings of elevated TH and low T levels, indicate hypothyroidism. This condition occurs when the thyroid gland fails to produce sufficient thyroid hormones. Levothyroxine is the standard treatment for hypothyroidism and works by supplementing the deficient hormones. Hypothyroidism presents with symptoms like weight loss, tachycardia, and anxiety, which are not consistent with Sarah's presentation. Iron deficiency anemia and type 2 diabetes do not explain the elevated TSH or the presence of goiter. Question 6. A 3-year-old child, Lucas, presents with a persistent rash that has been present for over a week. The rash started as small red spots on his face, then spread to the trunk, and now is present on his arms and legs. The spots are slightly raised and blanched with pressure. His parents mention that Lucas has been irritable and has had a mild fever for the past 2 days. The child's immunization records show that he is up to date on his vaccines. What is the most likely diagnosis? A. Measles. B. Scarlet fever. C. Hand, foot, and mouth disease. D. Rubella. Answer: D. Rubella. Explanation: the clinical presentation of a mild fever, irritability, and a spreading rash starting on the face is most consistent with rubella, also known as German measles. Rubella typically presents with a maculopapular rash that begins on the face and spreads downward. The rash tends to blanch with pressure and it is often accompanied by mild systemic symptoms. The child's immunization status suggests that the child has received the vaccine, which includes protection against rubella. Measles would present with more severe rash and cough, and it usually starts with high fever and characteristic Koplik spots. Scarlet fever presents with sandpaper-like rash and sore throat, and hand, foot, and mouth disease typically involves lesions on the hands and feet. Question 7. A 2-year-old child, Mia, is brought to the emergency department after a fall from a play structure. She is crying and holding her left arm, and there is noticeable swelling over her elbow. X-rays reveal a supracondylar fracture of the humerus. What is the most appropriate next step in management for Mia's fracture? A. Apply a long arm cast and monitor for signs of infection. B. Perform immediate reduction of the fracture and apply a splint. C. Refer Mia to pediatric orthopedics for surgical intervention. D. Apply a sling and ice the area, allowing time for natural healing. Answer: C. Refer Mia to pediatric orthopedics for surgical intervention. Explanation: supracondylar fractures of the humerus are common in young children and require careful management due to the risk of neurovascular injury, particularly to the brachial artery and median nerve. These fractures often require reduction and possible surgical fixation, especially if there is any displacement. Referral to pediatric orthopedics is the most appropriate next step for surgical evaluation. Applying a cast or a splint without reduction could lead to improper healing, and waiting for natural healing without proper management could lead to significant complications. Question 8. A 10-year-old boy, Daniel, is diagnosed with asthma. He has been using his albuterol inhaler for quick relief, but continues to experience frequent daytime symptoms and nighttime awakenings due to wheezing. His symptoms are poorly controlled despite using the inhaler regularly. What is the best next step in Daniel's asthma management? A. Increase the frequency of albuterol inhaler use. B. Add an inhaled corticosteroid X to the treatment plan. C. Begin oral corticosteroids to reduce inflammation. D. Prescribe leukotriene receptor antagonist Ultra. Answer: B. Add an inhaled corticosteroid X to the treatment plan. Explanation: Daniel's symptoms, including daytime symptoms and nighttime awakenings, suggest that his asthma is not well controlled with albuterol alone. The best next step is to add an inhaled corticosteroid X to address the underlying inflammation in the airways. Ikes are the cornerstone of long-term asthma management and reduce the frequency and severity of asthma attacks. Increasing albuterol use only addresses acute symptoms and does not manage inflammation. All corticosteroids should be used sparingly for exacerbations, not for daily maintenance. Leukotriene receptor antagonists can be considered as an adjunctive therapy but are not the first choice for controlling asthma symptoms. Question 9. A 5-year-old child, Eva, presents with a high fever, vomiting, and severe abdominal pain. The child is holding her right lower abdomen and has tenderness with rebound. A physical exam reveals rigidity in the lower abdomen and the child appears lethargic. What is the most likely diagnosis and what is the appropriate next step? A. Acute appendicitis. Refer for immediate surgical consultation. B. Acute gastroenteritis. Provide supportive care and hydration. C. Urinary tract infection. Initiate antibiotic therapy. D. Intussusception. Perform an abdominal ultrasound. Answer A. Acute appendicitis. Refer for immediate surgical consultation. Explanation: Iva's clinical presentation, including fever, vomiting, severe abdominal pain localized to the right lower quadrant, and signs of peritonitis, rigidity, and rebound tenderness, is highly suggestive of acute appendicitis. This condition requires prompt surgical intervention to prevent complications such as rupture and peritonitis. Acute gastroenteritis, typically present with diarrhea and less localized pain. Urinary tract infections, UTIs, may cause abdominal pain, but would not present with fever and localized tenderness to the right lower abdomen. Intussusception usually presents with intermittent abdominal pain and occurrent jelly stool, which is not consistent with Eva's presentation. Question 10. The 13-year-old boy, Noah, is diagnosed with type 1 diabetes and is currently managing his blood sugar levels. With insulin therapy, he reports recent episodes of dizziness, confusion, and shakiness during physical activity, especially when exercising after school. His blood sugar levels are monitored regularly, and his parents are concerned about his well-being during sports activities. What is the most appropriate recommended? Address Noah's symptoms. A. Decrease the frequency of insulin injections to prevent hypoglycemia. B. Increase caloric intake before exercise to prevent hypoglycemia. C. Adjust insulin therapy to be taken after exercise. D. Discontinue physical activity and allow rest until blood glucose stabilizes. Answer: B. Increase caloric intake before exercise to prevent hypoglycemia. Explanation: the symptoms Noah is experiencing, dizziness, confusion, and shakiness, are indicative of hypoglycemia, a common concern for children with type 1 diabetes, especially during physical activity. Increasing his caloric intake, such as consuming small snack that includes carbohydrates before exercise, is the best way to prevent hypoglycemia. Physical activity. Adjusting insulin timing may not fully address the potential for low blood sugar during exercise, and discontinuing physical activity is not an appropriate long-term solution, as exercise is important for overall health. Reducing insulin doses may lead to poor overall glucose control and other complications. Question 11. A 4-year-old boy, Leo, presents with a history of a persistent cough, fever, and nasal congestion for the past 3 days. His parents report that his symptoms began after he attended daycare. On examination, he has a low-grade fever, mild wheezing, and nasal flaring. A chest X-ray reveals hyperinflation of the lungs with a few areas of atelectasis. What is the most likely diagnosis? A. Acute bacterial pneumonia. B. Bronchiolitis. C. Asthma exacerbation. D. Foreign body aspiration. Answer: B. Bronchiolitis. Explanation: Leo's symptoms of cough, fever, wheezing, nasal congestion, and the findings of hyperinflation and atelectasis on chest X-ray are characteristic of bronchiolitis. This viral infection, most commonly caused by respiratory syncytial virus or RSV, affects young children, particularly those under the age of 2. The hyperinflation seen on X-ray is indicative of obstructive changes in the small air, which is common in bronchiolitis. Acute bacterial pneumonia usually presents with more focal findings on X-ray, while asthma exacerbations typically involve wheezing with a history of recurrent symptoms. Foreign body aspiration is less likely without a clear history of choking or localized findings. Question 12. A 7-year-old girl, Emma, is brought to the clinic for an evaluation of her school performance. Her teacher reports that Emma has difficulty paying attention, often seems distracted, and has trouble completing tasks. At home, her parents note that she frequently interrupts conversations and has trouble sitting still during meals. What is the most likely diagnosis? A. Generalized anxiety disorder. B. Attention deficit hyperactivity disorder, ADHD. C. Major depressive disorder. D. Oppositional defiant disorder. Answer. B. Attention deficit hyperactivity disorder, ADHD. Explanation. Emma's symptoms of inattention, distractibility, and hyperactivity, difficulty sitting still, are suggestive of ADHD. HD is characterized by persistent patterns of inattention, hyperactivity, and impulsivity, developmentally inappropriate, and cause functional impairment in at least 2 settings, e.g. home and school. Generalized anxiety disorder typically presents with excessive worry and physical symptoms like restlessness, but not necessarily with inattention and hyperactivity. Major depressive disorder in children often presents with sadness and withdrawal. Oppositional defiant disorder involves irritability and defiance rather than inattention. Question 13. A 2-year-old child, Max, is brought to the emergency department after ingesting a small amount of bleach from a household cleaner. Max is asymptomatic with no signs of distress. What is the best course of action? A. Observe in the emergency department for 4 hours and discharge if asymptomatic. B. Administer activated charcoal to prevent further absorption. C. Induce vomiting to clear the bleach from the stomach. D. Perform an upper gastrointestinal endoscopy to assess for injury. Answer. A. Observe in the emergency department for 4 hours and discharge if asymptomatic. Explanation. Ingesting a small amount of bleach generally does not result in significant toxicity, and if the child is asymptomatic, observation for a few hours is usually sufficient. Inducing vomiting is not recommended due to the risk of aspiration and further injury. Activated charcoal is not effective in absorbing bleach as it is not absorbed by charcoal. Upper gastrointestinal endoscopy is typically reserved for cases with symptoms or suspicion of significant injury, such as vomiting, drooling, or difficulty swallowing. Question 14. A 16-year-old girl, Lily, presents with a sudden onset of severe headache, nausea, vomiting, and photophobia. She has no significant past medical history and has been in good health. On examination, she is febrile, and her lumbar puncture reveals an elevated white blood cell count, low glucose, and high protein. What is the most likely diagnosis? A. Tension headache. B. Migraine. C. Meningitis. D. Sinusitis. Answer. C. Meningitis. Explanation. Lily's acute onset of severe headache, nausea, vomiting, photophobia, fever, and abnormal lumbar puncture findings, elevated white blood cells, low glucose, and high protein are consistent with a diagnosis of meningitis. The low glucose and high protein levels in the cerebrospinal fluid (CSF) are suggestive of bacterial meningitis, although viral meningitis can also present with findings, albeit typically with a less severe clinical course. Tension headaches and migraines usually do not cause fever, photophobia, or abnormal CSF findings. Sinusitis can cause headache, but it is typically associated with facial pain and congestion, not the neurological signs seen in meningitis. Question 15. A 10-year-old boy, Jackson, is brought to the clinic with complaints of joint pain and swelling in his knees and wrists for the past 3 weeks. He also has a red rash on his cheeks that appears after being in the sun. He has a history of recurrent mouth ulcers. On examination, he has bilateral joint swelling, especially in the knees and wrists, and a butterfly-shaped rash across his nose and cheeks. What is the most likely diagnosis? A. Rheumatic fever. B. Systemic lupus erythematosus. C. Juvenile idiopathic arthritis. D. Psoriatic arthritis. Answer. B. Systemic lupus erythematosus. Explanation. Jackson's presentation with joint pain, swelling, a butterfly-shaped rash across his face, and recurrent mouth ulcers is most consistent with systemic lupus erythematosus, SLE. SLE is an autoimmune disease that commonly affects young children, especially females, and can present with a variety of systemic manifestations, including a characteristic butterfly-shaped rash, joint pain in the knees and wrists, and all ulcers. Rheumatic fever typically follows. A streptococcal throat infection and causes migratory arthritis with carditis, while juvenile idiopathic arthritis typically causes prolonged joint inflammation without the characteristic rash. Psoriatic arthritis presents with joint pain, psoriasis, and nail changes, which are not seen in this case. Question 16. A 3-year-old child Ivor presents with a persistent cough, wheezing, and difficulty breathing that has worsened over the past 2 days. Her parents report that she has had a history of similar symptoms during the winter months, but this episode seems worse than previous ones. On examination, she is tachypneic, using accessory muscles to breathe, and has expiratory wheezing on auscultation. A peak flow measurement is significantly reduced. What is the most likely diagnosis? A viral upper respiratory infection. B. Croup. C. Asthma exacerbation. D. Pneumonia. Answer: C. Asthma exacerbation. Explanation: Ivor's history of recurrent wheezing and difficulty breathing, along with her current symptoms of tachypnea, use of accessory muscles, and expiratory wheezing, is most consistent with an asthma exacerbation. Asthma is a chronic inflammatory disorder of the airways, often triggered by viral infections, allergens, or other irritants. The significant reduction in peak flow further supports this diagnosis. Viral upper respiratory infections and croup can cause respiratory symptoms, but are not typically associated with the chronicity or reduction in peak flow seen in asthma. Pneumonia typically presents with fever, cough, and focal lung findings on examination. Imaging, not primarily wheezing. Question 17. A 15-year-old girl, Sarah, presents with fatigue, weight loss, and increased thirst and urination over the past few weeks. She has no significant medical history, but reports a family history of diabetes. On examination, she has dry mucous membranes and rapid, deep breathing. Her blood glucose level is 400 ppm, and her urine is positive for ketones. What is the most likely diagnosis? A. Type 1 diabetes mellitus. B. Type 2 diabetes mellitus. C. Diabetic ketoacidosis (DKA). D. Hyperosmolar hypoglycemic (CHS). Answer: C. Diabetic ketoacidosis (DKA). Explanation: Sarah's presentation with fatigue, weight loss, increased thirst and urination, along with dry mucous membranes, rapid breathing, and significantly elevated blood glucose 450 mg and urine ketones is highly suggestive of diabetic ketoacidosis (DKA), a life-threatening complication of diabetes most commonly seen in type 1 diabetes. It occurs when the body starts breaking down fat for energy due to an insulin deficiency, resulting in the production of ketones. Although Sarah's blood glucose is elevated, her ketones and rapid breathing, small respirations are indicative of DKA rather than simple hypoglycemia or type 2 diabetes. HHS is more common in older individuals with type 2 diabetes and is typically characterized by extremely high blood glucose with significant ketosis. Question 18. A 6-year-old boy, Luke, is brought to the clinic with a history of persistent abdominal pain and occasional vomiting for the past week. His parents report that his appetite has decreased and he has lost some weight. On examination, his abdomen is tender in the right lower quadrant and there is rebound tenderness. His white blood cell count is mildly elevated. What is the most likely diagnosis? A. Gastroenteritis. B. Appendicitis. C. Peptic ulcer disease. D. Intussusception. Answer: B. Appendicitis. Explanation: Luke's presentation of persistent abdominal pain with tenderness and rebound tenderness in the right lower quadrant, along with a mild elevation in his white blood cell count, is most consistent with appendicitis. Appendicitis typically presents with abdominal pain that starts around the umbilicus and then localizes to the right lower quadrant, along with fever, anorexia, and vomiting. Gastroenteritis is more to present with diffuse abdominal pain and diarrhea. Peptic ulcer disease usually presents with a history of gastric symptoms like epigastric pain and is less likely to present with rebound tenderness. Intussusception typically presents with intermittent abdominal pain, bloody stools, and a sausage-shaped mass on abdominal examination, not rebound tenderness. Question 19. A 10-year-old boy, Ethan, is brought to the clinic for evaluation of his inability to focus and complete his homework. His teacher reports that he is easily distracted and often forgets to bring in his assignments. His parents note that he frequently interrupts conversations and seems restless at home. His developmental history is unremarkable, and there is no family history of psychiatric disorders. What is the most likely diagnosis? A. Generalized anxiety disorder. B. Attention deficit hyperactivity disorder (ADHD). C. Specific learning disorder. D. Oppositional defiant disorder. Answer: B. Attention deficit hyperactivity disorder (ADHD). Explanation: Ethan's symptoms of inattention, distractibility, forgetfulness, restlessness, and impulsivity, interrupting conversations, are classic signs of attention deficit hyperactivity disorder (ADHD), are characterized by inattention, hyperactivity, and impulsivity that cause impairment in multiple settings, such as at home and school. Generalized anxiety disorder typically present excessive worry rather than inattention and impulsivity. A specific learning disorder involves difficulties in reading, writing, or mathematics, not generalized in attention and distractibility. Oppositional defiant disorder is characterized by a pattern of angry, irritable mood, argumentative or defiant behavior, and vindictiveness, rather than inattention and hyperactivity. Question 20. A 5-year-old girl, Olivia, is brought to the emergency department with complaints of fever, sore throat, and difficulty swallowing. Her parents note that she has had a cough for the past 3 days, but her symptoms have worsened. On examination, she has a high fever, enlarged tonsils with white exudates, and tender cervical lymphadenopathy. A rapid strep test is positive. What is the most appropriate treatment? A. Oral antibiotics for 10 days. B. Intravenous antibiotics. C. Supportive care only. D. Antiviral medication. Answer: A. Oral antibiotics for 10 days. Explanation: Olivia's presentation of fever, sore throat, difficulty swallowing, white exudates on her tonsils, and tender cervical lymphadenopathy, along with a positive rapid strep test, is most consistent with streptococcal pharyngitis, strep throat. The appropriate treatment for strep throat is a 10-day course of oral antibiotics, usually penicillin or amoxicillin, to complications such as rheumatic fever and to reduce the spread of infection. Intravenous antibiotics are not necessary for uncomplicated cases of strep throat. Supportive care alone is insufficient, as antibiotics are necessary to treat the infection and prevent complications. Antiviral medications are not effective against bacterial infections like strep throat. Question 21. A 3-year-old child, Noah, presents to the clinic with a 2-day history of fever, cough, and a harsh barking cough. His parents also report that he has become more hoarse and has difficulty breathing at times, especially at night. On examination, he is noted to have a stridorous cough and mild intercostal retractions. His temperature is 101 nec 38.3 dec. What is the most likely diagnosis? A. Acute bronchiolitis. B. Croup. C. Bacterial pneumonia. D. Epiglottitis. Answer: B. Croup. Explanation: No symptoms of fever, barking cough, hoarseness, and stridor, especially worsening at night, are typical of croup laryngotrachobronchitis. Croup is viral infection commonly caused by parainfluenza virus, and it leads to swelling and narrowing of the upper airways, resulting in the characteristic barking, cough, and stridor. Acute bronchiolitis typically presents with wheezing, respiratory distress, and history of viral respiratory illness, but not the barking cough. Bacterial pneumonia is usually associated with productive cough, fever, and focal lung findings. Epiglottitis typically presents with more severe, sudden onset sore throat, drooling, and difficulty swallowing, along with high fever and a tripodal position, and is often caused by Haemophilus influenzae type B. Question 22. A 14-year-old girl, Emily, presents with a 2-week history of fatigue, increased thirst, and frequent urination. Her parents also report that she has had blurred vision and weight loss despite normal appetite. On examination, she appears slightly dehydrated, and her blood glucose level is 450 mdl, wherein dipstick shows moderate ketones. What is the most likely diagnosis? A. Type 2 diabetes mellitus. B. Diabetic ketoacidosis (DKA). C. Hyperosmolar hypoglycemic state (HSD). Type 1 diabetes mellitus. Answer: D. Type 1 diabetes mellitus. Explanation: Emily's presentation with fatigue, increased thirst, frequent urination, blurred vision, weight loss, and markedly elevated blood glucose 450 mg with urine ketones is most consistent with type 1 diabetes mellitus (TDM) complicated by diabetic ketoacidosis (DK). Edema is typically diagnosed in children and adolescents and results from an autoimmune destruction of pancreatic beta cells leading to insulin deficiency. EK occurs when there is insufficient insulin, leading to hypoglycemia, ketosis, and metabolic acidosis. Type 2 diabetes usually presents with a more insidious onset and is less likely to present with ketonuria. HHSA, a complication of type 2 diabetes in older adults and involves extremely high blood glucose levels without significant ketosis. Question 23. A 5-year-old boy, Leo, presents with a 2-day history of high fever, sore throat, and a red inflamed rash that started on his neck and spread to his chest. The rash has a sandpaper-like texture and his tongue is coated with a white exudate. On examination, his tonsils are enlarged with white exudates. What is the most likely diagnosis? A. Scarlet fever, B. Measles, C. Kawasaki disease, D. strep throat. Answer A. Scarlet fever. Explanation. Leo's symptoms of high fever, sore throat, sandpaper-like rash, and enlarged tonsils with exudates are characteristic of scarlet fever, which is caused by group Streptococcus gas infection. Scarlet fever often presents with pharyngitis and characteristic red, raised, rough-textured rash that starts on the neck and spreads to the torso and extremities. The rash may be described as sandpaper-like. The coating on his tongue is common finding in scarlet fever and is often described as strawberry tongue. Measles typically presents with prodrome of cough, coryza, and conjunctivitis, followed by characteristic maculopapular rash. Kawasaki disease presents with fever, conjunctivitis, rash, and swollen hands and feet, but does not have sandpaper-like texture to the rash. Strep throat alone does not cause the characteristic rash seen in scarlet fever. Question 24. A 10-year-old boy, Jack, is brought to the clinic for a routine checkup. His parents report that he has become more fatigued over the past few months and has noticed some recent difficulty in keeping up with his peers in physical activities. On examination, he has an increased work of breathing with mild tachypnea and a prominent chest. His heart examination reveals a soft mid-systolic murmur. His peripheral pulses are weak and his blood pressure is lower in the lower extremities than in the upper extremities. What is the most likely diagnosis? A. Aortic stenosis, B. Tetralogy of Fowler, C. Coarctation of the aorta, D. Mitral valve prolapse. Answer C. Coarctation of the aorta. Explanation. Jack's symptoms of fatigue, tachypnea, weak peripheral pulses, and blood pressure discrepancy between the upper and lower extremities are most consistent with coarctation of the aorta, a congenital condition in which there is a narrowing of the aorta, typically near the ductus arteriosus. This results in increased blood pressure in the upper body and decreased perfusion to the lower body. The prominent chest may be to collateral circulation formed to bypass the narrowed area of the aorta. Aortic stenosis and tetralogy of Fowler can present with murmurs and symptoms of decreased exercise tolerance, but the physical findings, such as the blood pressure discrepancy, point toward coarctation. Mitral valve prolapse usually causes a characteristic mid-systolic click and does not explain the physical findings seen in this patient. Question 25. A 6-month-old infant, Mason, presents with poor feeding, vomiting, and lethargy for the past 2 days. His parents report that he has had a fever and a bulging fontanelle. On examination, Mason is irritable and his neck is stiff. His cerebrospinal fluid (CSF) analysis shows an elevated white blood cell count, low glucose, and elevated protein. What is the most likely diagnosis? A. Viral meningitis, B. Bacterial meningitis, C. Encephalitis, D. Cerebral palsy. Answer B. Bacterial meningitis. Explanation. Mason's presentation with fever, vomiting, lethargy, bulging fontanelle, irritability, stiff neck, and CSF findings of elevated white blood cells, low glucose, and elevated protein is most consistent with bacterial meningitis. Bacterial meningitis often presents with rapid onset of fever, irritability, vomiting, and altered mental status in infants, along with characteristic CSF findings. The low glucose and elevated protein in the CSF are typical for bacterial infections. Viral meningitis usually has more gradual onset and presents with normal or mildly low glucose levels level in the CSF. Encephalitis typically presents with altered mental status, seizures, and focal neurological findings, but would not typically present with the specific CSF findings seen in bacterial meningitis. Cerebral palsy, disorder caused by brain injury during fetal or neonatal development and does not present with acute fever, irritability, or CSF abnormalities. Question 26. A 4-year-old boy, Ethan, presents with a sudden onset of abdominal pain, vomiting, and a distended abdomen. His parents report that he had a recent viral upper respiratory infection. On examination, his abdomen is tender to palpation with a palpable mass in the right lower quadrant. An ultrasound reveals a target sign. What is the most likely diagnosis? A. Acute appendicitis. B. Intussusception. C. Gastroenteritis. D. Pyloric stenosis. Answer: B. Intussusception. Explanation: Ethan's sudden onset of abdominal pain, vomiting, distended abdomen, and the presence of palpable mass in the right lower quadrant, along with the ultrasound finding of target sign, is most consistent with intussusception. Intussusception occurs when one segment of the intestine telescopes into an adjacent segment, leading to bowel obstruction and ischemia. It is most common in children between the ages of 6 months, 3 years. The target sign on ultrasound is classic finding of intussusception. Acute appendicitis typically presents with localized right lower quadrant pain and tenderness, but it does not cause the target sign. Gastroenteritis usually presents with diarrhea and vomiting, but not with palpable mass or abdominal distension. Pyloric stenosis typically presents with projectile vomiting in infants, but does not cause an abdominal mass distension. Question 27. A 3-year-old girl, Ava, presents to the clinic with a 1-week history of coughing, runny nose, and low-grade fever. Her parents also mention that she has had a whooping sound after coughing. On examination, she is mildly tachypneic but otherwise alert. What is the most likely diagnosis? A. Asthma. B. Bronchiolitis. C. Pertussis. D. Influenza. Answer: C. Pertussis. Explanation: Iva's symptoms of coughing, runny nose, low-grade fever, and a whooping sound after coughing are characteristic of pertussis, also known as whooping cough. Pertussis is highly contagious respiratory illness caused by Bordetella pertussis and is marked by paroxysmal coughing followed by characteristic whoop as the child inhales after coughing fit. Asthma can present with coughing and wheezing but typically does not have the whooping sound. Bronchiolitis, caused by respiratory syncytial virus RSV, presents with wheezing, tachypnea, and respiratory distress, but without the characteristic whooping cough. Influenza can present with fever and cough, but it does not typically cause whooping sound. Question 20. A 16-year-old boy, Jack, presents with a 2-day history of severe headache, nausea, and photophobia. He also complains of neck stiffness. On examination, he has a positive Brzezinski sign and Koenig sign. A lumbar puncture reveals an elevated white blood cell count, low glucose, and elevated protein. What is the most likely diagnosis? A. Viral meningitis. B. Bacterial meningitis. C. Encephalitis. D. Subarachnoid hemorrhage. Answer: B. Bacterial meningitis. Explanation: Jack's symptoms of severe headache, nausea, photophobia, neck stiffness, and the positive Brzezinski and Koenig signs indicating meningeal irritation, along with cerebrospinal fluid (CSF) findings of an elevated white blood cell count, low glucose, and elevated protein, are most consistent with bacterial meningitis. The low glucose and elevated protein in the CSF are classic find for bacterial meningitis. Viral meningitis can present with similar symptoms, but it typically has normal or mildly low glucose levels in the CSF. Encephalitis typically presents with altered mental status, seizures, and focal neurological findings. Subarachnoid hemorrhage can present with sudden onset of severe headache, but it does not typically present with neck stiffness or CSF findings like those seen in meningitis. Question 29. A 7-year-old girl, Lily, presents to the clinic with a 3-day history of a sore throat, fever, and swollen lymph nodes. She also has a red raised rash on her face, which later spreads to her trunk and limbs. Her mother mentions that Lily had a cold a few weeks ago. On examination, Lily has a fine maculopapular rash and a positive Koplik spot in her mouth. What is the most likely diagnosis? A. Scarlet fever. B. Measles. C. Rubella. D. Fifth disease. Answer: B. Measles. Explanation: Lily's presentation with sore throat, fever, swollen lymph nodes, red raised rash that begins on the face and spreads to the trunk and limbs, along with the presence of Koplik spots in the mouth, is classic for measles. Rubeola. Koplik spots are small, white spots with bluish center that appear on the buccal mucosa and are pathognomonic for measles. The rash typically starts on the face and then spreads down the body. Fever presents with sandpaper-like rash and is caused by Streptococcus pyogenes infection, but it does not have Koplik spots. Rubella German measles also causes rash but does not have the same characteristic distribution or Koplik spots. Fifth disease, erythema infectiosum, caused by parvovirus B, presents with slapped cheek rash but does not have Koplik spots. Question 30. A 2-year-old boy, Noah, presents with a 3-day history of high fever, irritability, and a red inflamed rash. His parents report that the rash first appeared on his face and spread to his body. On examination, the rash is maculopapular and blanching. His mucous membranes are red and he has a sore throat. What is the most likely diagnosis? A. Scarlet fever, B. Measles, C. Roseola, D. Rubella. Answer: C. Roseola. Explanation: Nose presentation with high fever, irritability, and rash that started on the face and spread to the body is most consistent with roseola, and also known as sixth disease. Roseola is caused by human herpes virus C. HV6 and typically affects children between 6 months and 3 years of age. It often begins with high fever for 3-5 days, followed by the sudden appearance of maculopapular rash. As fever subsides, the rash generally starts on the trunk and spreads to the face and extremities. Scarlet fever is caused by Streptococcus pyogenes and presents with sandpaper-like rash. Measles presents with more typical sequence of symptoms including prodrome of cough, conjunctivitis, and Koplik spots, followed by rash that starts on the face. Rubella typically presents with mild rash that starts on the face and spreads, but it is usually accompanied by lymphadenopathy.